Okay, we're gonna run Kristen through kind of a rough cam evaluation. We'll take her through everything. Normally we would do both sides. So I'm gonna just have her, Kristen, I want you to internally rotate your hip. Good. Internally rotate this one. Good. We're having her do this actively from neutral, externally rotate. Good. Again, from neutral, externally rotate. Good. I'm going to have you out at 30 degrees abduction, external rotate, good, internal rotate, good, same thing on this side, external, good, internal, good. I'm seeing a lot of internal rotation on that. I'm going to have you actively flex at 30 degrees, keep that hip straight, internal rotate, good, external rotate, good. I'm going to bring you out here, internal, good, external, good, and then we'll have you adduct, internal, good, external, good. We check that on both sides. Gonna bring her up to 90-90, so you're gonna flex your hip, internally rotate, or externally rotate, good, bring it out, good. Same thing here, we would test both sides, bring that hip all the way down, excellent. We'd look at knee extension actively and extend, good. And we'd look at knee flexion, bring it straight down, good. Have her internally rotate, bring it straight down, good. Have her externally rotate, bring it straight down, good. I would then have you flip onto your stomach. Again, we'd normally do this on both sides, so flip on your stomach for me. We'll go this side. Bring up your knee up to 90 degrees. Just extend up. Good. Fully internally rotate your hip. Extend up. Externally rotate your hip. Good. And fully internally rotate your hip. Extend up. Excellent. And then we'd also look at internal, external rotation in prone. So externally rotate, good. Internally rotate, good. Flip back onto your back. Lower the table here. Scooch back just a touch, good. Have her actively plantar flex, good. Gonna have her actively dorsiflex, good. We're gonna bring her down into that half calf position. We're going to have her actively dorsiflex. Plantar flex and then invert. Good. Active plantar flex and then evert. Good. Okay, so we are going to start with glute max. So for glute max, I'm going to have her on her stomach. This is going to be for the iliac fibers. She's going to be slightly abducted away. She is going to flex her knee to 90 degrees. She's going to fully externally rotate her hip, and then she's going to extend. Good. And relax. Hold. Good. Hold that there. For the muscle test, I'm pushing down with a slide out. Hold, 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 hold. Excellent. And again, hold, hold, hold. Excellent. To deformat this, I am going to hit the lateral third of the ilium. Kind of a broad base. We're going to hit at the gluteal tuberosity. At that inferior gluteal fold. We're going to hit down off of IT band, right at that superior lateral condyle of the femur. And then we're going to hit in here down at the tibial tubercle. Excellent. And we'll retest, bring her out, actively flex 90, full external rotation, extend up. Don't let me push. Good, and that's better. To do her picks, relax for me. She's going to be in the same position, and I'm just going to cue her. Push up into my hand. Excellent. Hold 6 times, 6-second holds. For glute max for the sacral fibers, same position, but no internal or external rotation. I'm just going to have her extend up. Good. Hold there. Hold, hold, hold. Excellent. And relax. For the DIFA again, we're going to hit that iliac crest. Hit at the gluteal fold, IT band, and down at tibial tubercle. Retest, extend, making sure she's not coming up there. Hold, hold, hold. Excellent. To do the to do her picks, relax completely here, Kristen. Good. Pull up into my hand. Hold, hold, hold. 10%, 6 times 6-second holds. For the coccygeal fibers, same position. She's going to be slightly adducted this time. She's going to fully internally rotate. And I'm going to have her extend her hip. Good. Don't let me push. Hold, hold, hold. Excellent. DIFA mat, we're going to hit the same spots again for her picks. She's going to internally rotate. She's going to lift up. She's going to stay into that internal rotation. She's going to relax completely. Good. Keeping that internal rotation. Push up into my hand. Good. 6 times 6-second holds at 10%. Excellent. Next one, psoas. Let me have you flip on your back. All right. So for psoas test, she is going to externally rotate. She is going to abduct her hip to 30 degrees. She's going to flex up. These are for the lumbar fibers. I'm pushing down with a slide out. Hold, hold, hold. And those are really weak. To deformat this, I'm going to let her be in a little bit of knee flexion just so she can relax. We're going to hit the anterior bodies of L5 to L2. So if under iliac crest is L4, we're going to move up, make sure we're not on the aorta. We're going to deformat all the way down to L5. Excellent. And then we're also going to hit the lower trochanter. The lesser trochanter. So greater trochanter's here, lesser trochanter. We're going to drop, push up into my hand just a little, kind of feel where psoas is, good, and relax. And we're going to drop in there. Sorry. Super tender.
Those tickles.
Super tender one. Good. We're going to retest external rotation. Abducted 30, flex to 45. Hold. Good. For the picks, I'm going to have her relax into this position. She's going to push up and in into my hand. 6 times, 6-second holds, 10%. For psoas major thoracic fibers, same test, but we're only going to flex to 30 degrees, so hold it there. Don't let me push. Good. For the DIFA mat, we're going to be T12 to L1, so we're going to be up. Point out your belly button for me. Good. So we're going to be up a little higher, just below the rib cage. Again, staying lateral. Again, hitting through lesser trochanter. Retest, same thing, hold, good. For the picks, relax completely. 6 times 6-second holds, push up into my hand. Excellent. Diaphragmatic fibers since we're on the right side, it's going to be the upper 3 lumbar bodies. When we deformat, she's going to abduct, externally rotate, lift to 10 degrees, hold there. Good. You can see how she wants to come off the table. Point kind of right at your sternum. right, that xiphoid. Good, and relax. So we're going to be right in here. And we're also going to be up at the xiphoid process, just under the rib cage. Good. To retest, externally rotate, abduct to 30, 10 degrees, hip flexion, hold. Excellent, relax. And then push up into my hand, 10%, 6 times, 6-second holds for those. Glute min, we will do the anterior fibers first. She is going to internally rotate. She is going to flex to 30 degrees. Do not let me push you in. Hold, hold, hold. Good. And relax. Let's do that again. Internally rotate, 30 degrees of hip flexion. She's actually going to abduct to 30 for this one. Don't let me push. Good. With that one, I'm pushing into adduction with a little bit of extension. To look at the lateral division, I would have her externally rotate. She would hip flex to 30 degrees, abduct to 30 degrees. Don't let me push. Hold. Okay. To defamat, lay on your left side, so lay on the opposite side. And let her relax. We're going to be on that anterior iliac crest. This would be more for the lateral fibers. For the anterior fibers would be a little more anterior, and then down at the greater trochanter, kind of that anterior lateral border of the insertion. Good. Lay on your back. Normally we do these both separate, but for the sake of time, let's have you internally rotate, come out, flex at 30, and hold. Good. If we were doing the the picks here, she would stay in that same position. She'd relax completely, push out into my hand. Coming almost into straight abduction. Good, relax. And again, hold, 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 hold. So we do that for the anterior and the lateral fibers with the internal versus the external rotation into that position. All right. Glute med. She's going to be full internal rotation, abduct to 30, hold. I'm pushing her into straight adduction. That is going to be for the anterior fibers. Middle fibers, she's just going to straight abduct. No internal or external rotation. Hold. Good. For the posterior fibers, she's going to be full external rotation. Abduct to 30 and hold. Definitely a little weaker on those, so let's treat those out. Let me have you lay on your stomach. I'm going to work on the right side since we saw some weakness through there. So we're going to be kind of lateral ilium. Excellent. Down to greater trochanter. That insertion, lay on your back. We're going to retest the posterior fibers, so I want her full external rotation. Abduct to 30, don't let me push. Hold, hold, hold. Excellent. To do her picks now, we'd be in that position. Relax for me, let me have it. Push out into my hand. Good. Try not to lift up here, so relax completely. Push out into my hand. Good. And again, making sure that she's not coming up into hip flexion, activating those hip flexors. For hip flexors, iliacus, she's going to be full external rotation. She's going to flex to 30 degrees. we're going to push down with a slide out. Good. To deformat that, we're going to hit the anterior iliac crest. So we're dropping in here. I'm going to let her relax. We're going to get down into lesser trochanter. Good. Retest. Just going to externally rotate. Flex to 30. Hold. Down with the slide out. Excellent. Relax completely. I'm going to have you push up into my hand for the picks. Good. 6 times, 6-second holds. Excellent. For rectus, she is going to, this is for the straight head. She's going to flex to 30 degrees. We're pushing down with a slide out. Hold, hold, hold. Definitely weak through there. We are going to start here at AIIS. Just a little medial. Good. We're going to hit superior patella. And then we're going to get in here off a tibial tubercle. Doing our crosses. She's going to retest. Flex to 30 degrees. Hold there. Hold, 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 hold. Excellent. To do our picks. Relax completely for me. Push up into my hand. Hold, hold, hold. 10 times, 10-second holds. To hit the anterior fibers, the reflected head, she's going to be full internal rotation. Flex up to 30. Hold there. Hold, hold, hold. Deformat, we're going to be the same thing. We're going to be on that AIIS, just dropping in a little medial. We're going to be superior patella. Our cross, we're going to be tibial tubercle. She's going to internally rotate, flex to 30, hold, 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 hold. Good. To do the picks, relax, push up into my hand, keeping that internal rotation. 10%, 10 times, 6 times 6-second holds. TFL, she is going to anterior fibers internally rotate. Abduct to 30 degrees. She's going to flex to 30 degrees. And then she is going to not let me push her down. Hold, 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 hold. That one is weak. For the lateral fibers, she's going to be in the same position. So internally rotate. Abducts, flex to 30, but I'm going to push down and a little more in. So those are your lateral fibers. To deformat, I'm going to be ASIS. Sorry, a little more lateral. So I'm working kind of right in here. We're going to be on the outside at that IT band, right at the insertion. We're going to be inferior IT band, kind of the lateral condyle of the femur, and then we're going to be at tibial tubercle. Doing our crosses on those. We'll retest, internally rotate, abduct, flex to 30. For the first one, don't let me push down. For the more lateral fibers, don't let me push. Good. For the picks, if we're doing lateral fibers, keeping that internal rotation, I'm having her relax completely, push up and out into my hand. Good. For the anterior fibers, same thing, but she's pushing up. 6 times, 6-second holds. Sartorius, she is going to be in the figure 4 position. Good. Do not let me pull this knee out. Excellent. That one is actually good and strong. For her picks, we're going to be inferior to the ASIS. Excellent. We're gonna throw her out into this position. Push up into my hand so I can feel hamstring. Good, relax. So we're gonna be in the most anterior aspect on the lateral side of the pes group. Good. To retest, we're going to put her here. Don't let me pull. Excellent. If we were doing our picks, same thing. Pull into my hand. Good. And relax. 6 times 6 second holds. Piriformis, let me have you lay on your stomach. Hold all these guys, and then on the adductors, we'll turn it off and do a second video. Okay. She's going to be prone. She's going to flex her knee to 90 degrees. Slight abduction. We're going to take her into full external rotation. Okay. She's going to keep that. I'm going to support her here. Don't let me pull you out into internal rotation. Good. You can feel how weak that is. We're going to defamat on the sacrum about halfway down. We're going to work between the psoas and the coccyx. And that posterior superior greater trochanter. Good. To retest, bring her out. Good. Hold, hold, hold. Good. To defamat, she's going to be in that position. Relax. Pull into my hand. Hold, hold, hold. Not quite so hard. About 10%. Hold, 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 hold. 6 times 6 second holds. We don't want her coming up off the table. Quadratus femoris. Lay on your back for me. She's going to be supine. We're going to flex to 75 degrees. We're going to fully externally rotate the hip. Good. Do not let me pull you this way. Hold, hold, hold. Excellent. Flip onto your stomach for me. To defamat, we're going to do this posterior lateral position of ischial tube. So find ischial tuberosity. We're going to be a little bit superior. We're going to be a little bit lateral. We're going to drop right in there. And then we're going to find greater trochanter. We're going to drop just a little bit inferior, posterior to the greater trochanter, a little bit medial. Good. To retest, flip over. We defamatted the other leg, but we'll still do this one. 75 degrees of hip, full external rotation, hold. Good. To do the picks, again, she's holding it there. I'm just giving a little support. I'm not holding it up. Pull into my hand. 6 times 6 second holds. Good. Obturator externus, same thing, except she's going to flex to 110 degrees or as far as she can. Full external rotation. Good. Don't let me pull. Okay. Flip onto your stomach. Find an ischial tuberosity. We'll actually treat it on the right side. Find an ischial tube, and we are going to be just a little bit superior and lateral. And then we're going to find greater trochanter. We're going to kind of curl around here from the same side on this one. Almost like we're trying to curl under. Good, flip back over. Just going to flex your hip as far as you can, full external rotation, and hold. That one is still pretty weak, so we'll do our picks. Just going to hold 6 times 6 second holds. Good.